Hello, I'm Gerald Breeden. I work here in the Men's Health Clinic and also oversee the Osteoporosis and Bone Health Clinic at Urology Associates. Today we're going to talk a little bit about osteoporosis. It's a major public health threat for an estimated 44 million Americans. In the U.S. alone, there's 10 million individuals that have the disease of osteoporosis. 80% are female and 20% are male, which used to be a common myth. 34 million people have low bone density, and that means they have osteopenia, and this is borderline bone loss. And just to explain briefly, I have a lumbar spine bone here, and these are the different areas. You can see a normal bone here. And then as we move up, this shows borderline bone loss. And then further, as we go on up, you can see a bone that is at increased risk of fracture, and it's osteoporosis. Men with prostate cancer have that's a major risk factor, and they have an increased risk of osteoporosis as well. Let's talk a little bit briefly about cost. The latest figures show that osteo-related fractures were responsible for about $19 billion, and experts predict that cost in 2025 could be as much as $25 billion. You may ask, well, am I at risk for osteoporosis? And here are some of the major risk factors that we include in our bone density clinic. Age over 65, past history of smoking, moderate to heavy alcohol usage, family history of osteoporosis, history of broken bones, low sex hormones, for instance, low testosterone, chronic steroid use like prednisone, usage of certain seizure medicines, and also the diagnosis of thyroid disease. The focus at the Men's Health Clinic is using the latest technology to diagnose osteoporosis and osteopenia. Included are a DEXA scan. This is a quick and easy test. It's done in a matter of minutes. It's a very simple test to determine your bone density. And this gives us a Z-score, and we individualize this score for each and every patient and discuss with them major risk factors. Our treatment consists of adequate intake of calcium and vitamin D. We also encourage light resistance weight training for most of our patients in the Men's Health Clinic. Again, we stress decreased dietary sodium because sodium can be a concern and cause increased bone loss. Finally, we talk about smoking cessation to all of our patients. In summary, I've talked about osteoporosis, and we've covered the definition, diagnosis, risk factors, and treatment of osteoporosis. We are your partner in healthcare and look forward to seeing you and working with you at the Men's Health Clinic at Urology Associates. Thank you.